A review of urodynamic parameters in spinal cord injured patients with a supra-pubic catheter, comparison of clamping versus free drainage, by Alicia Koonjul, Sarah Knight, Rizwan Hamid, and Martin Knight. Patients with a spinal cord injury will have neurogenic lower urinary tract symptoms, including the inability to empty the bladder and neurogenic detrusor overactivity. The gold standard for bladder emptying is to use intermittent self-catheterization. However, patients with limited hand function may not be able to perform this. Therefore, many patients use an indwelling suprapubic catheter to empty their bladder. At our Spinal Cord Injury Centre, we recommend that patients initiate a regime of catheter clamping in order to preserve the bladder capacity and reduce irritation from the catheter tip. A clamping regime is recommended if urodynamics has shown that NDO is controlled and it is safe to do so. Initially, we recommend clamping at least once per day. Some patients will be able to release on air sensations, others after a specific time. Aims of the study. Previous studies have shown mixed results for the effect of clamping on bladder capacity and compliance, perception of comfort, upper tract deterioration, and urinary tract infections. The aim of the study was to carry out an audit of the urodynamic parameters of patients who have a suprapubic catheter and to investigate whether the urodynamic parameters were different between the groups of patients who use a clamping regime and those who leave their catheter on free drainage. Methods and materials. We aim for all spinal cord injured patients at our centre to undergo annual surveillance urodynamics. All urodynamics is performed using ICS guidelines. A retrospective study of 243 serial urodynamic studies were performed. 43 patients with an SPC were identified, of whom 22 were on a clamping regime, and the remaining 21 were using free drainage. The urodynamic traces were examined and maximum systometric capacity, maximum detrusor pressure, and compliance were recorded for both groups. Patient demographics. There were 43 spinal cord injured patients with an SPC identified from the urodynamic traces. The age range was 22 to 85 years. 28 patients were male and 15 were female. Of the male patients, 15 were using free drainage and 13 were clamping their catheters. Of the females, 6 were using free drainage and 9 were clamping. 63% of the patients with an SPC had a cervical spinal cord injury. 31% had a thoracic injury, 3% had a lumbar, and 3% had either cauda equina syndrome or spina bifida. The graphs on the right here show the proportion of cervical and thoracic injured patients that were clamping or using free drainage for their catheters. The results for maximum systometric capacity, or MCC, are shown in the bar chart on the left. The bars indicate the mean MCC for patients using free drainage and a clamping regime. The dots indicate the individual values for each patient. There was a statistically significantly higher MCC in the patients using the clamping regime compared to the patients using free drainage. The graph on the right shows the mean and individual values of maximum detrusor pressure, or MDP, for both groups of patients. There was no significant difference between these two groups. With respect to compliance, 64% of patients using a clamping regime demonstrated reduced bladder compliance on urodynamics, compared with 70% of those on free drainage. This was not significant. Additionally, 6 patients who were using free drainage leaked during the urodynamic investigation, compared with none of those who clamped. So, to conclude, previous literature used mixed clamping regimes. This retrospective study showed that there was a statistically increased bladder capacity in the patients who clamped compared to those using free drainage, and there were no other significant difference in urodynamic parameters. The limitations of the study was that it was a retrospective review of the data. Different treatment and clamping regimes were used within the cohort, and there could have been possible bias in the patients who continue with clamping regime. Further prospective studies required to identify if clamping can improve bladder parameters following spinal cord injury. Thank you for listening.